Hello everyone, this is Chadi Alraies from ARCH 2023. I'm really privileged today to be with Dr. Ryan Mader, who's been pioneer for robotic coronary angiography. Ryan, so nice to see you.
Yeah, good to see you.
Yeah, so you just gave a phenomenal talk about updates, potentials, as well as barriers for remote cath. So just give us a brief about what's up to date now.
Yeah, so I think as the audience may know, we've been doing robotic procedures, in the United States, robotic PCIs for over a decade now. And it's been shown that you can do both simple and complex, coronary interventions using a robotic system. But what we've been interested in developing, and we've been researching this for 9 years now, is the ability to do, telerobotic PCI and other telerobotic endovascular interventions where you would, as a physician, be in one geographic location and the patient would be at a completely separate geographic location, right. And you would use a robotic system to do that endovascular intervention. And based on the preclinical work that we've done, we know that we have the technology to do this. We've done it in simulators, we've done it in animal models, and Tejas Patel in 2018 did it in 5 humans from a distance of 20 miles away, where he did PCI and all successfully. But I think now we're getting to the point that we're really trying to figure out how to operationalize it. And the reason that we want to operationalize it is that there's still huge disparities in treatment of care, even in the United States, based on where you live. Patients with heart attack and stroke don't get the same treatment if they live in a rural area compared to if they live in an urban or suburban area, and so we're trying to address those disparities with the development of telerobotics.
So just to walk us through, somebody in a cath lab in a rural area, it's not a PCI lab, and then what they do, they just do access, and then they give a sheet. You put the sheath in, and then the operator on the other end somewhere continue with the procedure.
That's the idea, is that yes, you would need somebody at the bedside with the patient to initiate the procedure, but that the interventionalist that is far away would be the one that actually does the endovascular intervention, using, again, robotic systems.
What are the main barriers, or I should say, kind of things that can make you awake at night that make you cannot execute it to the level that you want?
Yeah, there's still a lot of questions about the performance of the networks. How good is the internet connection going to be between the two locations? How reliable is it? And those are things that we're studying now to try to understand that. We do think that public internet in the United States probably is sufficient enough to support long-distance telerobotic interventions, but we need to study the reliability of those networks. Still worry about complications. How do you manage a complication if you're not there with the patient? And I do think there are ways that we can learn to manage those, from afar, including with the robotic system. And so that's stuff that all still needs to be studied.
Absolutely. And last thing is radiation risk. Definitely you are cutting back on radiation. So basically you can do it within your lab, away robotically, preventing radiation, which is a big hazard.
Yeah, a huge hazard, and Jim Goldstein just gave a really nice talk here on radiation safety and all of the occupational risks that we face as interventional cardiologists and all of our cath lab staff. And so with the robotic system, because you're sitting either in a cockpit or in the control room, the radiation is essentially zero. And so it's a safe way, and you don't have to wear lead when you're doing it. So
it's a physical burden as well.
So I think there definitely is a safety reason to consider adopting robotics.
What's the future holds? And you said, congratulations, you received a large grant to support this project, which is a great initiative. So what does the future hold? Yeah,
we're working right now with this grant to build the first telerobotic network in the United States, and so we hope to connect our hospital in Grand Rapids, Michigan to multiple other hospitals in the United States, and start to study the ability to do telerobotic interventions from one hospital to another to try to reach those more rural areas that may be facing either shortages of interventionalists, or the patients just don't have access to the same treatment that our patients do.
Absolutely. Congratulations again.
Yeah, thank you.
Ryan, for your time, as well as for the grant. And please watch these videos and others on YouTube channel. This is Chadi Alraies from ARCH 2023. Ryan, thanks so much for your time.
Yeah, thanks, Chadi.